Hello, I'm Dr. Robert Lelouch, board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk about headaches, especially headaches in pregnancy. Now let me preface this, I'm not a neurologist. I'm not an expert for headaches. If you have complicated, difficult problems with headaches, you need to speak with your doctor or speak with your neurologist. However, I have lots of experience with patients with headaches, especially in pregnancy, and I'm going to give you some insights that will help with pregnancy and may also help you even if you're not pregnant. So this is going to sound like a trick question, but it's not a trick question. So think about it for a moment. What's the purpose of headaches? I'll give you a moment to think about that. So I'm going to make it a little bit easier. What's the purpose of pain? Would we be better off if we didn't sense pain? Well, the answer is no. So if you haven't already figured it out, pain is our alarm system. It's our safety mechanism. You put your hand on a burner, it starts to burn. You feel pain, you take it off so you don't burn your hand. Okay, so in fact, there are people who lose the ability to sense pain with diabetes, nerve damage, and they start getting lots of injuries. Infections, injuries to their feet, lose their limbs, okay? And there are people who can't sense pain and don't live as long because they need their alarm system to protect them. Okay, so let's get back to headaches. What's the purpose of the headache? It's to tell you something's wrong, okay? So let me give you an example. I'm an obstetrician. Every few days, I'm up all night delivering babies. The next day, I got a headache, 100% of the time. My body's saying, what the hell? Why didn't you sleep? I need some sleep. And I get a headache. And guess what? If I ignore that headache and do nothing and keep pushing, it gets worse. And then it gets worse. And then finally, I gotta lay down and stop what I'm doing. It stops me because it's saying, you're not taking care of me, you're not getting rest. So in pregnancy, if you're having headaches, your body's telling you something like you're not getting enough rest, or you're low blood sugar, you're not eating enough. Well, maybe you're nauseated and you're not eating enough, or you've been throwing up from nausea. See those other videos, that can cause headaches. Also, maybe you're not drinking enough fluids. You get dehydrated, you can get a headache in pregnancy. So when you and your baby have to fight for food or sugar or water, your baby wins and you get a headache, okay? Maybe you're stressing too much. Maybe everyone around you is being annoying. Maybe you're working, taking care of other kids and taking care of things at home as well, meaning burning the candle at both ends. You'll get a headache from that. So listen to your body and try to figure out, be your own detective, figure out what's going on, work with your provider, okay? If you have really bad headaches, you need to work with them. And remember, this is for early on in pregnancy. Later on in pregnancy, there are all the other videos that headaches can be a sign of high blood pressure pregnancy or preeclampsia. You need to be on top of that. Watch those other videos and again, discuss that with your provider. Okay. Now, one thing that lots of pregnant women do is they want to avoid medications. And so they don't take medicines when they have an early headache, when in fact, that's when Tylenol, for example, can be very helpful. So acetaminophen Tylenol can be very helpful for mild headaches, but in my experience, it's not really good for really bad ones. So feel free to take it early on. Don't exceed the normal amount. Don't eat it like candy. But it is okay to take in moderation early on before headache gets really bad. So I hope you found these insights useful. Please leave your comments. Really appreciate it. Thank you.